Today we're going to be doing tests that involve the structures within the subacromial space. The subacromial space is a small area located in the shoulder joint, which is situated between the acromion and the upper end of the humerus bone. This space is filled with soft tissues, including muscle tendons and ligaments, which play an important role in maintaining shoulder stability and movement. The subacromial space is what allows for proper movement and gliding of the soft tissues within the joint. It is this that allows the shoulder to perform different movements like rotating, lifting, and reaching. However, due to its complexity and large degree of mobility, it is prone to injuries such as rotator cuff tears, bursitis, tendinitis, and impingement syndrome. To find out whether or not there's a subacromial impingement, there are a ton of tests that, well, there are not a ton, a couple of tests that we're going to be doing. And yeah, let's get started. Okay, for this first test that we're going to do is the painful arc test. Basically, the purpose of this test is to diagnose the condition. As the test is being performed, the person feels pain or discomfort in a specific range of motion that can indicate that there may be irritation or impingement. What you're going to do is ask your client to abduct their arms to 180 degrees. If at any point they feel pain between 70 and 120 degrees, that can indicate a positive test. The discomfort is most commonly felt at the anterior shoulder or the deltoids. If they didn't feel any pain throughout the test, then the test was negative. For this next test, we're going to be doing the empty can test, which is done to assess if there's a supraspinatus injury, such as a supraspinatus strain or tendinitis. It is one of the three structures that's located in the subacromial space. And to this, you're going to get your client to abduct to 90 degrees horizontally and adduct to 30 degrees. And then you're going to get them to internally rotate their arm. And then you're going to apply pressure on their shoulder, wrist. And as you push down, they're going to push up for 5 seconds. 1, 2, 3, 4, 5. And what you're looking for is pain or weakness in the shoulder compared to the other side. If there's any pain or weakness, it is considered a positive test. If there isn't any pain or weakness, then it is considered a negative test. For this next test, we're going to be doing the speed test. This test is done for bicep injuries and is done to find out if there's a bicep strain or tendinitis. This test addresses the long head of the bicep, which is one of the structures. You are going to ask your client to lift their arms to 90 degrees and then to subinate their hands so the palms are up. And then you're going to put your one hand on their shoulder, one hand on their wrist, and you're going to push down while they push upwards for 5 seconds. And basically what you're looking for, a positive test would be if they felt any pain or weakness. And if there's pain in the shoulder or the bicep, that's considered a positive test. And if they're not feeling any pain, then that's a negative test.